And welcome to Chapter 2. Again, my name is Michael Purdy. I am a nationally certified paramedic and hold North and South Carolina paramedic certifications as well. Been involved with the Henderson County Rescue Squad now for a few years, and I operate as an employee and volunteer status with multiple other agencies here in Western North and South Carolina, covering firefighting, rescue, EMS. Been doing this for about 15 years all in all, and I've been a paramedic for coming up on 10 years now as well. So in this chapter, workplace safety and wellness, we're going to dive a little bit deeper into the topic of how to keep ourselves safe and well and ready for duty, and increasing the longevity of our career and ways to prevent injury on scene. So please remember to keep writing down some questions, taking notes throughout the class if there's anything, or the lecture. If there's anything that confuses you or you don't quite understand, or you'd like a little bit more information on, write that down, and then when we meet in person in our classroom sessions, we can have that group roundtable discussion on that and kind of dive deeper into those questions as well. All right. So some considerations that we always need to keep in mind for our safety is we want to perform our standard safety precautions, utilize our PPE or our personal protective equipment. This can be anything from our BSI or body substance isolation, like our gloves, our N95 masks. It can be traffic vests, hard hats, safety glasses, anything of that nature. We really need to pay a special attention to stress management as well, recognizing the signs and the indicators of stress in ourselves and our coworkers. And then we have to be prepared for dealing with death and then dying individuals. Oftentimes, we will be the last people that some of these individuals will see before they die. And we, a lot of times, will be in an isolated situation where it is just us and that individual as well. And sometimes there's nothing we can do to prevent it. And then crew resource management and prevention of our work-related injuries and illnesses. And that kind of goes back into like our PPE topic as well. So it is a stressful job. We see a lot of stress factors that most people in day life will never actually encounter in their entire lives, or maybe just once or twice in their lives. And we come in, bebopping in lights and sirens into a situation, and we subject ourselves to these high stressors on a daily basis, multiple times a shift. And then even sometimes as a volunteer, when you're not on shift, you get up, you leave your home and your family, you leave your dinner table to go to these high stress situations. And some things, they leave images in your brain that you take home, and if you don't process them properly or manage those, they can snowball on you and pile up. So your partners, your patients and their families, they experience various degrees of stress and grief during and following medical or traumatic emergencies. We in emergency services have a very unique and specific way that we kind of mitigate and deal with these stressors that are not necessarily applicable to family members or friends of the victims or the victims themselves. So we have to be mindful when we're on scene of how we are handling these stressful situations and how it may be perceived by those individuals. You need to learn how to avoid unnecessary stresses and how to prevent your stress level from getting too high and how to manage that. Sometimes it may be as simple as not going into a scene that already has enough resources on it that you don't necessarily need to involve yourself in, or after the fact managing those stressors. To fulfill your duties as an EMR, you need to be in good physical condition. We're lifting people of similar size to us, sometimes lighter, sometimes much heavier, but also a lot of unconscious patients or people who physically can't help us. So we have a lot of stress and a lot of strain on our bodies. If you're involved in You're going out in the wilderness or in a wooded setting or austere environments. We have a lot of other stress factors physically in those fields and those types of calls that put a lot more strain on our bodies. And we need to be able to support ourselves and our patients, and sometimes even our partners or other responders on those calls. And as an EMR, we should always go through complete physical exams yearly or routine exams with our healthcare provider, just to make sure that we are tracking on a healthy regimen. So stresses on or after calls. Sometimes a stress can go unnoticed for days, weeks, or even years, but they can include patients who remind you of a close family member or a friend. Very young patients are especially stressful or stress-inducing, just simply for the fact that they're just tiny, they seem frail, and they can't communicate with us the way that I am communicating with you now. They're typically nonverbal. If they are verbal, small children, they may not want to communicate with a complete stranger, or they might shut down when they're in pain or they feel ill. And then similarly with very old patients, patients with dementia, Alzheimer's, or they may have a medical condition that prevents them from being able to communicate in a standard way that we typically think as a normal communication. We'll see a lot of critical patients who are actively dying, and we are actively trying to prevent that death from occurring. And then ultimately we do see death a lot in this field. Sometimes we see death occur as we're standing there. Sometimes we see it post-mortem, and we come to help deal with that body and move that body to another facility. We have a lot of unusual, dangerous situations, things that the typical layperson will never see in their lives. We encounter a lot of violence, a lot of domestic violence. We have a lot of road rage instances. You'll be on scene of a motor vehicle accident where the two drivers are wanting to argue or fight with each other. We see a lot of behavioral disturbances, psychiatric type calls, and then of course the domestic situations that a lot of times we have to tread lightly on, because we're not the judge, we're not the jury. We're there to provide medical care, prevent further injury. Sometimes separating individuals from a situation is the best course, or deferring to law enforcement and let them take care of that. We have a lot of unusual sights, smells, sounds. Once you've been doing this for a while, you'll go to sleep and you'll wake up in the middle of the night to the sound of your pager going off, or you'll hear sirens while you're sleeping, only to realize that the pager did not go off, the sirens are not going. It's just in your brain, and your brain kind of gets attuned to that. And then you have a high potential of encountering mass casualty situations. And remember, a mass casualty situation by definition is a situation that overwhelms the resources that are currently available. So you could theoretically have two patients that overwhelm your resources, and technically you are in a mass casualty or MCI situation. Typically we kind of consider that like 5 or more victims. But if you find yourself in a situation where you don't know which way to go and you don't have enough resources to manage this situation, you are technically in an MCI situation. And that in itself can be very stressful, just having that overwhelming sense of not being prepared or not being able to manage the situation yourself. So early recognition of that and requesting an allocation of those appropriate resources can go a long ways. Learn to recognize the signs and symptoms of stress. The earlier we can recognize these, the better, so that we can mitigate and manage these high stress levels. And we can always adjust our lifestyle to include stress-reducing activities. My personal favorite is hiking. I do a lot of rock climbing. I go caving, canyoneering, just a general exploring. One of my more recent things is I like to study our local history, going back into the 1700s, and it's really fascinating for me, and it helps me kind of take my mind off of any stressful situations that have recently gone through. And then there's always resources available. If you're a member of the Henderson County Rescue Squad, we have a CIS person embedded within our agency that if you ever do have emotional stressors or situations that you can reach out for them to help. Other agencies and counties in the Western Carolinas also have their own form of CISDs or CIS agents to help. So many things can trigger grief. A lot of times this will be something that is kind of under the surface for a long time, sometimes up to years, that we don't really realize is there until we come into a trigger. So death of a loved one is definitely a big trigger. There's a major injury or a traumatic experience to either yourself or witnessing that for someone else. A serious illness. If you or a loved one are sick for a prolonged time, or is a very serious or critical type of situation, it can be very demoralizing and cause a lot of extra stress on you. Drug and alcohol addiction. Some people don't even realize that they've gotten into a situation where they are in an addictive situation or with an addictive substance. Incarceration, going to jail would stress out a lot of people, myself included. And then ending of a relationship or a divorce. And then major personal rejection, termination from an employment, or not being hired for a job at an interview, things like that. So some of the warning signs that we can look out for, excuse me, they're not always necessarily there. Sometimes they are. Sometimes it's one or several that are noticeable, and sometimes you could have all of them. But irritability, inability to concentrate, change in your normal disposition or normal behavior or habits, difficulty sleeping or having nightmares, increased anxiety, indecisiveness, and just not being able to find a specific direction to go with and going with it. And a lot of these calls and situations, dynamic situations that we have, we need to sometimes just pick a path, pick a direction and go. If the situation changes, we need to have that ability to stop, reassess, pick another direction and go instead of just trying to figure out which way to go. And then guilt. Did we do everything that we could for that patient? That's probably one of the main things that I deal with other coworkers is don't get hung up on, did I do enough? Could I have done it differently? There's a certain degree of what could I have done differently that we can learn from and adjust for the future. But we don't want to eat ourselves up with that, I should have done more, or I could have done more. We want to be as proactive and use that as beneficially as we can. Loss of appetite or even overeating, loss of interest in sexual relations, loss of interest in work. I would actually, most honestly, I'd love to stay home and play all the time, but everybody has to work to some degree. Isolation, people who just prefer to spend their time alone, and that is abnormal for that person. Feelings of hopelessness, and then of course alcohol and drug misuse or abuse. And then you also have some physical symptoms as well. Preventing stress. Probably one of the best things we can do is change our diet to be healthy, well-balanced. And that in itself, it makes your body functions, your gut, digestive system, the way you metabolize the food that you eat, it just makes it function better and gives you more energy, makes everything internally function better, and that translates or crosses over into less stress and better mental health. Drink, not alcohol. Drink water or hydrating fluids. Every human being on this earth is, or I would say a large portion of them is chronically dehydrated from the get-go. So if you get up off your couch and walk to the mailbox or the front door, you're dehydrated. So us in emergency services, we need to make it a point to hydrate and stay hydrated. And then this last one is be merry. When a person is happy, he or she generally is not experiencing an elevated level of stress. Therefore, it is important to learn to balance your lifestyle. Make jokes, entertain yourself, friends, interact with people in a jovial manner. Always also keep, remember to be respectful and, know your boundaries and things like that. But we want to have a good time and know when to have a good time and when we need to be serious. I mentioned, I believe in the chapter 1 about how, or it might have been earlier in this chapter, how we manage our stress very differently in emergency services than most typical lay people do. And sometimes our manner of humor or appreciation of that does not cross over very well. So normal reactions of stress typically happen in 5 stages. Our first is the denial. It's the not me phase. It can't happen to me. Then this is typically followed up by the anger stage, is why me, or this isn't fair that it is me. Followed by bargaining. It's okay, but, let's not make a deal to, or they're trying to make a deal to postpone death or dying or injury or the illness that they're experiencing. And then, of course, there's depression that follows that. You feel heavy-hearted. The person who is unusually silent, or who seems to retreat into their own world and become very detached from everything else. Acceptance does not necessarily mean that you're satisfied with what has happened or the situation. It just means that you understand that death and dying cannot be changed, or a medical condition or traumatic injury can no longer be changed. You just have to deal with it from this point on. And that can take various amounts of time for that to actually occur. So crew resource management is a way for teams to work together with leadership to develop and maintain a shared understanding of an emergency situation. One way to do this is with this acronym PACE. It helps EMS providers and other emergency responders to recognize potential behavioral situations or issues. This acronym is as follows. P stands for probe. You look or ask to confirm the problem or make sense of a situation. A stands for alert. We communicate the problem to the team leader once we recognize that there is a problem. C stands for challenge. If the issue is not corrected, then clearly challenge the team's present course of action that is leading to the problem and suggest an alternate path. E is emergency. If the problem is clear and critical, such as an immediate safety issue, then immediately communicate the emergency to the entire team. And this can be utilized preemptively. It can be utilized during a call, on scene, anywhere in emergency services. You can utilize this algorithm or this acronym. Moving on to infectious diseases. These are illnesses that are caused by germs such as bacteria, viruses, fungi. They can enter our body in multiple ways. They can spread from person to person. We need to maintain an awareness that infectious diseases or communicable diseases has increased in recent years, and recognize that it will continue to increase as things evolve and advance. New medications come out, and these diseases will alter, and new ones will be coming to light. There are 3 main methods of transmission. We have direct contact with the infectious agent, indirect contact, which is typically airborne droplets or spray or sputum, things like that, and then contact with infected blood. So BSI, get used to that. BSI, if you advance on through advanced EMT or paramedic, every time you do a scenario or a live training, that's one of those things. You're going to put your hands up and you're going to say, BSI, scene safe. That basically means I've got my gloves on. If applicable, I have my mask, my glasses, or my safety glasses on, my traffic vest, things like that. It's just kind of that universally loose term that we use for I am safe. I have taken all my precautions. Federal regulations require that all healthcare providers utilize BSI or body substance isolation that can prevent the spread of airborne transmission or blood or direct contact transmission. Standard precautions for the healthcare provider. We always want to wear approved gloves. Typically, you'll see only nitrile gloves out there because of the latex allergies that are so widespread now. But originally, it was commonplace to have latex gloves. We want to practice good hand washing techniques with soap and water after each patient contact and removing your gloves. And of course, every patient, save for probably a mass casualty incident, we want to change those gloves and have clean PPE or personal protective equipment on, or BSI, from one patient to the next. We don't want to be the problem by spreading germs directly. We always want to wear our protective mask in the events that there could be airborne or droplet-borne particulates, and then eyewear or a full face shield. Also, if you're involved in injections or handling needles for other advanced life support providers, things like that, we do not recap the needle. This meaning the protective cap that's on the end of the needle. We do not slide that cap back onto a dirty needle. And it's also good practice not to recap a clean needle either, just because of the increased likelihood of you sticking yourself. We also don't want to cut or bend needles. We want to place them directly into the sharps container. If you are ever on an older ambulance, one from the 90s, 80s, maybe even early 2000s, you might see on the bench seats little holes in the seats, and that was actually from providers taking needles and sticking them into the leather seat as a form of sharps protection, temporary sharps protection. That is not something that should be practiced, and is a very obsolete way of doing things. So those needles go directly into an approved sharps container. Okay. We need to stay up to date with the CDC and OSHA's lists of the various diseases and possible outbreaks in our areas, and stay up to date with our specific protocols for our regions. A lot of community-based outbreaks of influenza, or COVID-19, or other epidemic type diseases that require droplet precautions. And then also keeping in mind that when there's a suspicion for some kind of droplet or communicable disease of that nature, we can begin our assessment from standing back from the patient, say about 6 feet, and gives us a little bit of a safety net until we can kind of either one, decide if we should go back and get PPE on if we haven't done it already, or kind of rule out the probability of this being an infectious disease. But typically, nowadays, my standard go-to, if I'm going for a respiratory call, I'm going to go ahead and have some kind of PPE for surgical mask or something of that nature before I enter a residence, that I know this is what I'm coming here for. And then, of course, remember that good hand washing after every patient contact. But we'll talk about donning and doffing PPE, and we will go over this in practicum in our classroom session on how to properly apply gloves and remove dirty gloves. And the same with our masks as well. If we just simply grab a mask off of our face, that's not really a good way to do that. There's certain techniques to remove those as well. But we want to do it in as hygienic of a manner as possible. We don't, when we're taking our gloves off, if we have some kind of substance on the glove, we don't want to inadvertently get it on our skin, where then we might touch our face or touch a computer with those contaminated fingers of ours. For disinfecting, best thing to do is using these alcohol-based steri wipes or sanitation wipes and wiping down the surfaces. If you have a patient who you suspect might have had an air or a droplet-borne or a particulate-borne substance, allowing the back of your ambulance time for things to settle and then just simply wiping the surfaces up with that. Any kind of fabric like stretcher sheets or blankets, things like that, can go in for washing and proper deep sanitation that way. There are certain immunizations that are recommended for healthcare providers or EMS responders, such as yourself. These can include influenza, tetanus, and hepatitis B. We have our MMR vaccine, which is required by several agencies or many of the agencies. And then getting routine or yearly TB testing is also a requirement of most agencies throughout the United States. So now we're moving on to responding to the scene. Remember, scene safety is paramount. If the scene is not safe, we don't go in. End of story. We need to consider our own safety, safety of all other personnel or people present, including responders and bystanders, and our victims or our patients themselves. An injured or dead EMR, EMT, advanced EMT, paramedic, doctor, firefighter, law enforcement officer, what have you, cannot help those in need. And not to sound selfish or anything, but it creates a lot more work and stress on the system for everybody else involved. Now you have multiple situations that have to be mitigated and managed. We want to drive safely to the scene. We're not driving pedal to the metal to every call. We always want to use our seatbelts when we're driving to a scene. And then we can also use our vehicle to create scene safety if we're responding, say here, like in this upper right-hand corner on the interstate. You see that fire truck is actually parked at an angle and is effectively blocking that oncoming traffic from entering the scene. So if you're responding on an ambulance, you can kind of use your ambulance in the same manner. And then when a larger apparatus such as a fire truck arrives on scene, they will create a safety net for your ambulance and exclude that zone even further out. Vehicles like POVs, police cars and things like that are less ideal because they move if they're struck by a larger vehicle or a vehicle of similar size traveling at speed, and they can propel that vehicle into your scene. But if that's all you have starting out, it's a good way to start scene safety, and then you can add on to it as the incident progresses. Use your dispatch information to anticipate hazards and determine how to approach the scene. For example, if you are being dispatched to a tanker rollover that is on fire, you can assume that there may be potentially hazardous fluids inside that tanker truck. So maybe we don't want to get so close to the scene. We want to back off and stay away. Always look when we're getting out of our vehicle, even if we are in a perceived safe zone. Point of fact, several years ago, my wife was getting out of an ambulance on an interstate, and she got out, looked back at her partner, and all she saw was a vehicle fly by and crash into the accident scene that they were responding to, and her partner had disappeared. Fortunately, he was okay. He was able to get out of the way just in time, but the way things went, if it was any differently, it could have been a very bad situation. And that is why the federal safety standards requires us as EMRs or emergency service personnel to wear approved safety vests while we are working on roadways or highways. And these typically should be tearaway vests. They have the Velcro that allows, if you are snagged by a passing vehicle or something of that nature, for the vest to be torn away from you. But it is a high visibility reflective vest. And then, of course, if there's already adequate scene protection, go ahead and get your vehicle off to the side, get it out of the way, protect your own personal vehicle, especially if you're responding in your personally owned vehicle. There's no sense in having that destroyed when we can destroy a perfectly good fire truck. So making your scene assessment. This is also known as your windshield survey, scene size up. We want to scan the entire area for hazards that are present and address them or exclude them, isolate them as appropriate. If we don't have the means, we can make a mental note, set up a barrier, some caution tape, say don't go over here, or we can physically stop people from going over to this specific area. Control the flow of traffic. This can often be done with roadside signs, vehicle apparatus, lighting, and things of that nature to redirect traffic around the incident scene. If you suspect that there is a crime has been involved, we want to protect that scene and try not to disturb it or disturb it as minimally as possible for the investigations. If you are trained in law enforcement procedures, follow your local protocols, but most of the time when you're responding in an emergency responder scenario that's not involved in law enforcement, you're not going to be playing law enforcement when you're playing firefighter, in this region anyways. Crowds, so onlookers, bystanders, gatherings of people, they can be friendly and helpful, or they can turn on you and become hostile, creating what would otherwise be a stable situation into a very unstable or hostile situation. You can assess the crowd's mood before you get into a position from which you cannot exit, or you should assess that. Always keep in mind when you're on a scene or approaching a scene to not back yourself into a corner. Always be looking for ways of egress or escape. So if the situation does turn south on you, you can have a secondary means of getting out of there. When you feel things that are starting to escalate and becoming dangerous, go ahead and get law enforcement or additional resources en route before you actually need them. Once you need them, if you don't have them, things get very long and very dicey until things can get simmered back down. Any electrical issues, down power lines, things like that, don't approach the scene unless you are told by a trained power company technician or something like of that nature that the scene is safe. Always assume that a down power line is still live. They can come down and they can not blow fuses, and they can still be live. And you won't know it until you've been hit by it. Or potentially they might be arcing and things like that. Any incident where there's a potential for rescue operations of things of that nature, always don your proper or appropriate PPE. We should be wearing helmets with chin straps and eye protection around many of these types of calls, especially when there's tools moving around, glass breaking, things being cut, pried on. If there's a fire, keep in mind fire can result in injury or death of you or your patient or your patient. If you are a trained firefighter, follow your agency's protocols and procedures. If you're not a trained firefighter or rescue technician, know your limits and do not exceed them. Don't go in and try to conduct an operation that you are not qualified or trained for. Remember to never enter a burning building unless you have proper training and have donned the proper PPE. Carefully assess your fire hazards before you determine your course of action. And of course, if you're not a hazmat technician or level 1 responder, don't go into the scene if it's wet, sticky, not yours, smells weird, has a weird color, odor. Don't touch it. Don't go near it. Talking about protecting the scene, we'll go back just a little bit I touched on a second ago. Your first new unit arriving onto the scene, like you see here on the screen, should protect the scene from oncoming traffic. A lot of times, maybe not so much like these scenes on interstates, those are typically going to be law enforcement is going to be your smallest vehicle, and then you'll have the fire trucks will be responding. But on your secondary roads or even tertiary roads, it may be a POV or a quick response vehicle such as an SUV, something like that. but you can protect the scene temporarily with one of those vehicles. And then when the larger vehicles arrive, such as a fire truck, they can protect that first responding vehicle as well. Non-transporting units arriving second and third that are not needed directly at the scene can stage back and kind of give a visual warning for oncoming traffic that, hey, there's an incident up ahead, move over. And they can actually get out and direct traffic, deploy traffic cones or signage to alert oncoming drivers. We need to park our apparatus at an angle, like you can see here on the left side of the screen. Even the engine here in the middle is at a slight angle. The purpose of that is if a vehicle does miss all of your visual indicators and still hits that apparatus, it will deflect that vehicle away from the scene. An engine this size probably won't move very much unless it's an 18-wheeler or another large vehicle. But if it's a passenger-sized car, it may not move at all. It'll just simply deflect that vehicle away from the incident scene. We want to use our emergency warning lights. At nighttime, we want to dim our forward-facing lights or the lights that are on the side of the incident so we're not blinding our responders, and turn off as many of the white lights and things like that so that we're not blinding oncoming traffic or drivers. And then any extra apparatus that's not actively involved in managing the scene can be utilized for additional traffic control as well. And you can see here on the right-hand side of the screen, there's traffic cones that are deployed in an angulated line across that right-hand lane of travel, which in this image would be the left side. Even though they have an engine behind there, they still have those visual aids to indicate to drivers that they need to stay in that left-hand lane or that fast lane. Okay, hazardous materials. They can be found almost everywhere in almost every vehicle in some shape, form, or fashion. Federal regulations require that vehicles that are transporting certain quantities of these hazmats or hazardous materials to be marked with specific placards, like you see here on the right-hand side of your screen. And these are just examples of some of the various placards that you may see. And there's a lot more out there as well, with different numbers and indicators to say what is in that truck or in that vehicle. If you believe that a crash may be involving a hazardous material, we want to stop uphill and upwind at some distance from the crash. Use binoculars to determine whether the vehicle is marked with a placard. If you don't know what the placard means, you can always ask your dispatch or another responding unit that may have information or knowledge on that. Odors and fumes may be the first indication of a hazardous material, or multiple people laying on the ground for with no explanation as to why. That's typically more in a confined area. If it's an incident of a traumatic injury and you see multiple people, you may not be able to discern immediately why they're actually on the ground. Is it from the trauma, or is it from like a hazardous, like a gas leak or something like that, or toxic fumes? But we want to initially remain far enough away so that you do not become an additional casualty is the main goal there. Unstable objects, like the cow in the center of your screen. Unpredictable, you don't know what it's going to do. Also, unstable vehicles on their side, up on an embankment. I think a few slides ago we saw a vehicle sitting up on top of another vehicle, which would be considered to be an unstable object. Trees leaning over, laying on power lines, buildings, partial collapses, cliff sides. When I'm out doing my hobbies out at the base of cliffs or the top of cliffs, we're always wearing helmets because you never know when a loose object may be come loose, kicked, or thrown off the top of that cliff band and come down and knock us in the head. We don't really wear helmets for the climbing aspect of it. It's more for things falling down on top of us. And then also other piles of material, piles of lumber, trees, pallets, things like that, that can be unstable and can topple over. After an accident, vehicles may need to be stabilized before you can access or assess your patient or begin patient extrication. Undeployed airbags present another hazard following a motor vehicle collision. We also have fires, potential explosions can result in unstable buildings, or can be a result of unstable buildings. So we want to assess our stability before attempting to enter any kind of building that has sustained damage. If in doubt, we need to call for trained personnel. I'll go back and say if you're responding as an EMR and you don't have the specific training for unstable buildings, unstable vehicles, things like that, you need to go ahead and request the appropriate resources to manage that scene. Any kind of incident involving anything I just mentioned, you can just go ahead and assume that there's going to be sharp objects like this glass. Just FYI, this is not how we gain access to our patients by Hulk punching a window. We have specific tools that we use to do that so that we don't slice our arms up. But I thought it was a neat picture. Our PPE for vehicle extrication and other things of that nature, we're going to be wearing heavy leather gloves or other cut-resistant gloves over top of our medical gloves. These are not very expensive things that an agency can replace if they get saturated with gloves or blood, vomit, or other bodily fluids from that victim or that patient. Some other injuries that we might encounter can be pets, farm stock, or wildlife on the scene. Like I said, these cows in certain situations can be very unpredictable, and they are heavy, and they can plow us over. Some of the hazards that livestock can present on scene: biting, kicking, trampling. They can squeeze or press you up against a solid object. And then when talking about animals, we also have the smaller animals, people's dogs in their homes. They can be very confused and concerned. Even on medical calls, you have a bunch of strangers entering your house in uniforms, and even to animals, a uniform can be intimidating. Adding the fact that there's a bunch of strangers in their house and they're talking to their owner or their loved one who they know instinctively is already in some sort of distress, just whether it be from an emotional aspect or actually physically sick. So those dogs will be on heightened alert and very concerned as well. And then we also have other, more exotic pets. We have reptiles and venomous insects and things like that, spiders, that some individuals like to have in their house that we need to be mindful for. Not every house is going to have them, but something worth keeping in the back of your head. Okay, so let's talk a little bit about environmental conditions. We want to dress appropriately for the expected weather. If we know it's going to be raining, we should probably grab a rain jacket. If we know it's going to be cold, we should probably layer up. We also want to keep our patients as dry as possible and prevent hypothermia, especially in the winter months. Traumatic patients, that's going to be one of our number one, or trauma patients is going to be one of our number one concerns is hypothermia. So we want to go ahead and manage that from early on from the get-go. We want to use our emergency lighting when operating in the dark to help us avoid hazards. I carry a headlamp in my BDU pocket all the time, specifically because when you're on a call at nighttime and you need both hands to do something, it's very difficult to hold a flashlight in your mouth or on your shoulder and actually do what you need to do. So headlamps go a long way for helping you out. Some specialty rescue situations that we will go over in the TR classes, but these include water rescue. Around here, not so much ice rescue, but there is potential. Confined space or below grade rescue. This would be like a subterranean type rescue, such as caves or a type of man-made subterranean area. terrorism, and then also mass casualty incidences that could involve intentional or accidental. Okay, in summary, EMR should understand the role that stress plays in our lives and of emergency care providers and patients who have experienced sudden illness or trauma. Stress is a normal part of an EMR's life, so finding ways to manage and mitigate that is very essential to us. There are 5 stages of grief when dealing with death or dying. They are denial, anger, bargaining, depression, and acceptance. Patients and rescuers move through these stages at different paces or different stages, and that's normal. Stress management consists of recognizing, preventing, and reducing critical incident stress. Remember, on all calls, scene safety is important. And it is part of our job and responsibility to ensure that for yourself, your partner, and your patients, and then also your bystanders. We should understand how airborne and bloodborne diseases are spread and how we can prevent the spread of the same. We will go over in practicum the donning and doffing techniques that reduce the risk of contamination for gloves, masks, and other PPE. And then performing an effective scene size up helps us identify hazards, reducing risk of injury or death, and having an indicator or an advanced knowledge of what kind of resources we're going to need if we don't already have them. Looking back on everything that we just covered, I know it's a brief overview of this chapter, but developing a good understanding of the strategies and ways to manage and mitigate the stresses and ways to keep the scene safe, keep ourselves safe, really will go a long way towards giving us a long and fruitful career and benefit us in our overall lives. After this, I've got just a few review questions for you, but please remember, bring those notes into our live session classroom for us to go over and review as a group. And I'll go ahead and start the questions. Some common signs and symptoms of stress include, the answer is irritability. Typically, we're not irritable from the get-go, so anytime that there's an increase in irritability, that is a sign that something is affecting our general mental status or mental health. You are called to the scene that seems unsafe. What is your best course of action in this scenario? Correct answer would be wait at a safe distance and request for law enforcement. If the scene is not safe, we do not enter, or even if it is perceived as not safe. Which of the following is not a consideration when responding to an emergency scene? The correct answer is D, always using lights and sirens.